Testing, 1, 2, 3.
Jim, I think we're ready to start.
Hello, I'm Jim Powers. On behalf of the Tennessee Coalition for Better Aging, co-chairs Grace Smith and I would like to extend a warm welcome to the greater than 150 attendees at this meeting on reimagining long-term services and supports in Tennessee. The Tennessee Coalition for Better Aging is a statewide 17-member organization in its 5th year. The Tennessee Coalition for Better Aging exists to promote the general welfare of older Tennesseans and their families through partnerships that mobilize resources to educate and advocate for important policies and programs. The global pandemic has exposed gaps in Tennessee's long-term services and support system, and now is an excellent time to educate and raise awareness and interest in reimagining long-term services and supports informed by both national and state perspectives. What we mean by long-term services and supports is that wide spectrum of services and supports offered by multiple sectors across the continuum of care to enable adults to live well and age well, both at home and with community-based services in long-term care as well as congregate settings. Today is the first of 3 virtual meetings focused on improving long-term services and supports in Tennessee. We have 3 goals with this series. 1, to build interest and consensus in reimagining long-term services in Tennessee based on a growing older population and innovations in other states. 2, to create a shared vision with guiding principles for reimagining long-term services and supports in our state. And 3, to develop collective strategies and ideas as we work together to improve all sectors delivering long-term services and supports, be they government, nonprofit, private, philanthropy, or faith-based. Today's meeting will be fast-paced. During this meeting, you will learn why the time is now for us to reimagine the way we care for older adults and adults with disabilities. You will discover successful innovations from other states. You will hear from area experts with years of experience in long-term care policy. And most importantly, you will have a voice in what a reimagined system of care should look like for Tennessee. We will hear from experts whose life work is in long-term services and supports, from AARP, the leading age center for long-term services and supports at the University of Massachusetts, the Tennessee Comptroller's Office, the Tennessee Commission on Aging and Disability, and AgeWell Middle Tennessee. Now, it is my pleasure to introduce Steve Joyner, our moderator for these meetings. Steve is Dean of the College of Leadership and Public Service and Managing Director of the Institute for Conflict Management at Lipscomb University. Steve?
Hello, everybody. I'm honored to be your moderator for today's seminar or webinar as it is, and the 2 working meetings that will follow as the Tennessee Coalition for Better Aging invites us to reimagine long-term services and supports in Tennessee. Today's meeting is going to be more educational. It's going to be a webinar. It will be a transferring a lot of information in a short period of time. There's reasons for this. First is we need a common understanding of what's driving reimagining long-term services support, both the national and the state levels. We need to look at how other states are innovating long-term care support and then compare that with Tennessee's system. So we thought about it and realized this is probably the best way to go with that. My role is fairly simple, I'm here to keep us on time today mostly. And I'm also here to give you an opportunity to submit questions for the first 2 speakers. So as you listen, if a question comes to mind, please go to chat and submit it to the panelists. I'll be able to see it and then I'll just select a couple of questions from those that come in. These are private to the panelists only. Others won't be able to see those questions. Please participate in that, and perhaps we can learn from that. All right. Before our speakers begin, I want to invite you to answer a Zoom poll that will show up. That'll help us to know what sector and interest groups you represent. So it should be easy to do. Just click on the Zoom and submit your responses. And Rochelle, when you get your responses in, if you'll just please put those up. Well, it looks like a good cross section of people here today. A third of them are an aging and disability services advocate or provider. 20% close to are older adults. But I'm really pleased to have this good cross section of people. As we know who's here today, I look forward to working with you. Now that we know who's here, I want to give you a quick overview of our agenda. First, we'll have the national perspective, which is have a couple of different speakers talk about what's happening statewide. We'll then have some state innovations and lessons learned section, and then we'll have a panel, I believe, of 4 people who'll be talking Tennessee's long-term services and support system. And interestingly enough, we're going to end with the word cloud that'll inform us for our further work, and you'll be allowed to participate in what's called a Mentee word cloud at the end, and we'll instruct you, no big deal. So then we'll close out. We'll try to keep ourselves on time. With that in mind, I'd like to introduce Rebecca Kelly, and she will introduce us to our first speaker. Rebecca is the State Director of AARP and is a tremendous asset in this field. Rebecca, welcome.
Thank you, Steve, and thank you to the Coalition for Aging and Disability. We're delighted to be members of that coalition. A special thanks to Grace Smith and to Dr. Powers for the work they're doing in leading that coalition. It is my delight this afternoon to introduce a good friend of ours and a tremendous expert in AARP's national policy agenda. Dorothy Simon is responsible for the development and oversight of AARP public policies that address major issues facing older Americans. Dorothy is a member of the National Academy of Social Insurance. She also served as a commissioner for the American Bar Association's Commission on Law and Aging. Ms. Simon served as Director of Health and Long-Term Services and Supports from 2007 through 2013, and then served as the Vice President of the Office of Policy Development and Integration through 2017. Prior to joining the OPDI, Ms. Simon was a senior litigation attorney for over 10 years for the AARP Foundation, writing amicus briefs in federal and state courts, including the U.S. Supreme Court. In addition, she served as counsel in numerous class action cases involving Medicare, Medicaid, and long-term care facilities. Ms. Simon graduated from the Georgetown University Law Center. Dorothy, welcome to Tennessee.
Thank you. That was a very nice introduction. I really appreciate it. And thank you, Rebecca, for all the work that you do in Tennessee for AARP members. I also want to thank Grace Smith and Jim Powers, the co-chairs of the Tennessee Coalition for Better Aging, for organizing this event and including AARP in attempting to reimagine what long-term services and supports can be in Tennessee. And I hope Tennessee becomes a leader and there are lessons for others going forward as well. You know, long-term care is critically important to people across this country, and it's of critical importance to AARP. Today, I'm going to talk at a very high level on a range of things that AARP is focused on, but I also am going to point you to some resources, and I hope you're seeing on your screen now resources that we are highlighting, 3 different things that you'll hear me talk about and reference. So when I reference them, I'll point it out on the slide as well, because this is a major priority for AARP. We are very much engaged in this topic and trying to do the best we can for families and care recipients across the country who are profoundly struggling. It's impossible to talk about long-term services and supports at this time without acknowledging the current crisis and the depth of that crisis that COVID has brought to us. It really is a crisis, as you all know, of unprecedented proportions and complexity. And as it continues to progress, it's really become more than just a health crisis, but a profound disruption of our economic and social lives and resulted in a loss of so much human life. This disruption continues to impact our economy, and it threatens our broader stability across the world for the interdependence of our economies. Unemployment has risen. I think the full impact, what we say is the full impact of this crisis, both the economy and health, won't be known for some time. We're all just absorbing what is currently happening, how we can respond to today, where we are in the crisis, but the long-term impact on how it will shape and reshape society in significant ways is yet to be known. As many of you, I'm sure, are aware, the direct health impact of this disease has been just tremendously difficult for folks with underlying conditions, people of color, older people, particularly those living in residential settings. We are tracking this very closely. Over 172,000 residents and staff of nursing homes and other long-term care facilities have died from COVID, representing about 35% of all the COVID fatalities in the US, even though nursing home residents represent less than 1% of the population. So federal policymakers were slow to respond to this, and states need to do more as well to stem the loss of life. AARP, you will see on the slide, we have a caregiving nursing home. We have a nursing home dashboard. That's the second thing on your slide. And there I want to point you because it really is the ongoing voice that AARP is trying to bring to this debate, that we need to do better. We need to support nursing homes, and we need to figure out how to create the protection for the residents and the staff in these facilities. We need to minimize disease transmission. This is part of a 5-point plan that AARP has. If you go to that dashboard, you'll see it. And that includes protective equipment and really getting inspectors in there and monitoring with ongoing testing, improving transparency. That's about communication, data, accountability, listing, really sharing in a clear way what is happening at the time in real time with data so that the supports can be brought in to help stem the tide of this just terrible impact. We've also learned it's really critical to ensure in-person visitation at all times possible, but to also have virtual visitation. You're going to hear me say it later, quality of life is as important as quality of care. And this has been resonating in this pandemic because we know that if people do not have the ability to see their loved ones, to engage with people, the outcomes for them can be just as bad as the COVID outcome of getting COVID. So we need to balance those needs, ensure safety where we can, but virtual visitation is really critical. Ensuring quality for residents, again, that's talking about advocacy and access, ensuring that long-term care ombudsmen can get into these facilities and do their jobs and really work with residents to get their needs met, but also holding long-term care facilities accountable as appropriate. There are times in an emergency where things can't be done, but where there really is negligence, we need to hold facilities accountable. So the federal government has taken some action of requiring nursing homes to self-report and both cases and deaths at the federal level, ordering testing, providing PPE, vaccines will be coming, but there's still so much more to be done. And the federal government has also put out guidance about visitation, but we continue to worry about the need to make sure that visitation is happening, whether it's within protocols for safety for in-person or at least supporting virtual visitation so that folks can really get the interaction they need to continue their lives. As you know, Congress is considering legislation on COVID-19 right now, and we assume that this will pass in the next couple days, probably tomorrow is what I heard this morning. So AARP supported many provisions, many really important provisions in this legislation, and that's funding for state strike teams in nursing homes to help support facilities with those who are diagnosed or suspected of having COVID, both the residents and the staff. The legislation would also provide funding for infection control and support in nursing homes, and a temporary 7.35% enhanced FMAP, so that's the federal matching payment for Medicaid home and community-based services. AARP also supports provisions to increase funding for the Older Americans Act, the Elder Justice programs, and there's some funding in there as well for that. And AARP has also written to CMS urging them to update the guidance and criterion for in-person visitation and allowing families to really safely visit, and also collecting public data in nursing homes about vaccinations of residents and staff. So President Biden has also put forth proposals to expand access to home and community-based services and try to address institutional bias, support family caregivers in the form of a family caregiver tax credit, and address issues in nursing homes, other issues, and help the challenges with paying long-term services and supports workforce. And you're going to hear me mention workforce more than once going forward. While there are declines in cases coming now, we're still at a very high level. And while vaccines give us all hope that we can stem the tide, we still need to stay vigilant until we get to that place where there is some real consistent downswing in COVID cases and these bad outcomes. We're very concerned to hear about some hesitancy around vaccines because policymakers at the state level and AARP have been working to give as much information as we can. We're urging people to consider the vaccine, to really know the information, to hear about the safety of it and consider taking it. So we still have a ways to go on all of this to kind of stem that emergency need that's in front of us. And we'll continue to do that. AARP.org/nursing homes. You can find the 5-point plan I cited and really continuing updates. I mean, AARP is very committed to understanding what's happening in real time, tracking those numbers, and trying to continually respond as the situation changes and help to really come up with ways to address these problems sooner rather than later. We also have a caregiving site that's also on your slide, which gives you broader issues around nursing homes and caregiving and recent topics that are emerging, including things related to vaccination and access and information around that. So addressing these immediate needs in the crisis is ongoing and critical. We know that, but I know this group also wants to look more broadly ahead and think about what are the lessons from this crisis and what are you facing going forward. And when we think about that, we think a lot about, we all know the need is still growing. So you have this growing need, the age 80 plus population, those most likely to need assistance with activities of daily living are projected to triple between 2015 and 2050. And we also know the cost of care is rising. So I often point to the Genworth studies that really put out these numbers that are staggering. They're just staggering how much the cost of long-term care is, whether it's assisted living or home care or nursing home care. The numbers just keep rising. They talk about a national median of $51,000 per year for assisted living, home care as much as $53,000, and the national median cost for skilled nursing care in nursing facilities, $93,000 for a semi-private room and over $100,000 for a private room. So this is just staggering to individuals and everyone. How do we get after this? we're facing lots of challenges, and I'm going to talk about financing a bit later, but that is clearly one of them. What are the lessons we can learn from the pandemic? Well, the pandemic has really brought forth interesting things in the sense of, along with these terrible tragedies, we're also seeing an opening up of the use of technology. So there's much more telehealth being tested. There's much more telehealth access. Rules have been relaxed. And in that way, I think people have come to understand, wow, some of this can really work for me. And having access to either, whether it's remote monitoring or the ability to see your doctor from your home, I think it's really challenging premises that people had about what can be done from home. And I think looking at what technology is capable of and how it can empower and support home care could be really an interesting outcome from this terrible tragedy. We also need to rethink institutional care. As we look at all of these issues, we're looking at how is institutional care organized, how are nursing homes set up. We consistently hear people want a more home-like setting, even if they're in a nursing home. So how can those arrangements be set up in ways that help to prevent the passing of infection and really change the dynamic? And I know there's been culture change efforts in the past, the greenhouse work and other things. We need to revisit those, because what we consistently hear is wherever people are, they want a more home-like environment. And so ultimately what people want is choice. They want to receive services in the setting they want, and they want the services that they need that really meet their individual needs. So that's the overall goal for us. And of course, I can't not mention they want to feel safe in an emergency, no matter where they are, whether that's in a nursing home or in a home and community-based setting, or in their own home. They want to feel safe. So we need to continue to take from the lesson from the pandemic also of how do we ensure that. But following along with this theme of choice, and that's really a frame that AERP puts around long-term services and supports.
5 minutes.
Thank you. People want choice. 77% of the people we poll say they want to have home and community-based care rather than care in other settings. So we need to up our game in terms of giving access to home and community-based care. And at AERP, we think of communities more broadly as well. We want to support age-friendly communities. When people are out in the community getting services, they are walking around their neighborhoods. They are accessing things outside of their homes. And so we have a big initiative around age-friendly. Rebecca Kelly can tell you more about this subsequently, but it's really an effort to acknowledge that communities are better for everyone when they're age-friendly. And it is about access to transportation, access to affordable housing, the ability to really have a walkable neighborhood and opportunities to participate. So we see those things as very much linked. So again, the other theme I would put out there is, besides choice, and most of the people want to live at home or live in home and community-based care settings and in communities that are age-friendly, they also really value their quality of life and the people that are supporting them. So prioritizing person-centered, family-centered care that really acknowledges that importance of quality of life is very much important. And achieving quality is a challenge. We all know that. We have to have good systems that allow oversight, that help us keep track of what's happening, no matter where the care is delivered. And a key portion of achieving quality is staffing. We've seen this. We need to really support the workforce and make sure we're facing a workforce shortage now, given the low wages that workers face in any part of this industry. We're going to continue to face that. So we need to figure out ways to support the workforce better and really look at how to address that shortage, because many of the nursing homes that we saw in the pandemic did better where the staffing was better. And so staffing is just critical. And that really leads me to, many of the challenges in getting paid staff are very clear. We need to improve wages. We need to improve working conditions, support that. But we also really need to have acknowledgement that a huge amount of care gets delivered by family caregivers who are unpaid. And so AARP has a tremendous amount of work we do around supporting caregivers. And we need to think about how to do that. There are many states that allow paying family caregivers because they're the people that are there and it disrupts them so economically, they can't possibly take care of their loved one plus sustain themselves economically. We need to challenge and think about that. And AARP has done some work looking at what states are doing around that. And we also need respite care and a whole range of supports for people to ensure that that family workforce is really there. And finally, I'll talk about affordability briefly, that, you know, affordability is critical. And you heard me say how much long-term care costs. We know that Medicaid is the safety net. We also know that we need more financing options as we go forward. So I would just leave you with a few more points. I hope I'm not running up against my time too much. Tennessee also, we have a scorecard that AARP puts out that measures states against other states. And Tennessee has some opportunities on choice and improving support for family caregivers. Those are two measures on which Tennessee has doesn't stack up so good against other states and could really do much more. I hope I have the opportunity to share some examples going forward in your meetings. Arkansas, Georgia, they're doing some really interesting things around choice, as well as Virginia has a directory. So I think I'm losing my time here. I have about 1 minute. So I will close with just saying, as you think about principles going forward and what you can do, think about AARP as a resource to help and support this thinking. Think about consumer choice. Remember that quality of life is as important as quality of care. People really want to have that quality. Workforce is essential. And we need to think about how to address financing, because if we don't attack financing, we have ongoing affordability issues.
Thank you, Dorothy, so much. There's one question that popped up here. Dorothy, got a minute or two to talk about it. They want to know, could you expand a little bit on what AARP offers for caregivers with adults attending adult daycare? Is there anything in that field you guys deal with?
You know, I don't know specifically what AARP is doing around adult daycare. I can think that we have certainly a planning guide that is around planning for caregiving that talks about how to integrate the type of care that you as a caregiver are lining up for the care recipient. One option is adult daycare. But beyond that, I think we're looking at if you as a caregiver need additional support, you know, adult daycare is only so many hours a day. What are the available services for respite? How do we get more support to you as the caregiver who's trying to build a care system around that adult daycare? That's what comes to my mind. I don't know, Rebecca, if you have other thoughts of things that AARP is looking at in particular to adult daycare.
I appreciate that. I think that's a good start. Great conversation, Dorothy. Thank you so much for giving us that national perspective from the AARP. I think we'd like to move on to our next speaker, who also has a national perspective, and that is Dr. Mark Cohen. He's a co-director of the Leading Age Long-Term Support and Services Center at UMass in Boston's co-author of a 2020 report entitled Learning from New State Initiatives and Financing Long-Term Services and Support, which he'll be sharing the highlights of that today. So Dr. Cohen, we'd love to hear from you.
Thanks so much. Hello, everybody. It's great to be visiting down in Tennessee, getting away from the 18-degree weather here in Boston. First, I want to thank the Tennessee Coalition for Better Aging, and in particular, Grace and Jim for inviting me to speak today. Can I have that first slide so I can tell you what I'm going to do is just provide some very quick few basic statistics, background on LTSS financing, talk a little bit about our study, and then present some of the findings from that study. Next slide. So to begin, the long-term services and supports financing challenge is big. You know, we're talking about roughly 25 million of today's seniors are going to need LTSS, both paid and, as Dorothy mentioned, unpaid. And these costs taken together will exceed over $2.5 trillion over the next 10 years. And the fact is, most Americans are unprepared to absorb these costs. On the one hand, many people are not poor enough to immediately qualify for the social safety net, meaning the Medicaid program. So if they need care, they're very exposed to potentially catastrophic costs. Private insurance, long-term care insurance, has not grown to meet early expectations, with many of today's products out of the financial reach of the broad middle class. Fewer than 10% have insurance today. And the projected need and lack of financial protection leaves families with ever-increasing caregiver burdens. In short, LTSS needs undermine individuals' preparedness for retirement, where there is already a very concerning shortfall. Next slide. The largest public payer of LTSS, the Medicaid program, faces major financial challenges. As I mentioned, obtaining eligibility through spend down is a threat to many individuals' financial security. Many Medicaid programs have long waiting lists and limitations on access that keep people who need home and community-based care, for example, from receiving it. And this is also due to certain state-based inflexibilities with respect to program requirements. And the fact is that states are really struggling with budget pressures because LTSS is now approaching anywhere between 30 and 45% of state Medicaid budgets, and it's growing rapidly. And perhaps most importantly, the reimbursement rates. How do states control these costs? They ratchet and they cut back on reimbursement rates. And so by doing so, it does not support the development of a high quality workforce and service infrastructure. So these first two slides, I wanted to just make a single point about these first two slides. And that is that this problem of LTSS financing in particular is too big for any one sector to handle on its own. Neither the public sector nor the private sector will be able to address the level of need that is emerging all across the country. So where does this leave us? On this slide, the long and the short of it, without getting into all of the details, is that the financing system is not serving families well, it's not serving caregivers well, and it's not serving public and private payers very well. And so as a result, policymakers, and in particular, state policymakers, are looking for new solutions. Next slide. Why are states showing growing interest in this issue? Well, first of all, as I mentioned, limited growth in the private market is fueling a search for shared or communal approaches in states. And frankly, the gridlock that has been observed in federal policymaking does not offer a lot of promise, or at least it hasn't over the last number of years. And changes in family composition, as I mentioned, are leading to strains on the budget, workforce, and delivery system. In short, what you have is many policymakers are starting to come to the conclusion that the costs of waiting for something to happen are actually exceeding the costs or the risks of taking some action. So on the next slide, so my colleagues and I embarked on a study to look at what was happening across the country with respect to state initiatives. And we conducted a qualitative case study of 6 states at various stages of the reform effort. And I'm going to focus in a minute on 3 of them. Basically, we interviewed stakeholders in these states, described some of the challenges that they've been having and their reform process. And I'm going to review some of that with you now today. Next slide. So this is a quick summary of some of the state-based activities. Here are the 6 states that we focused on. And I'm going to just focus on 3, give you details on 3 that are fairly far along. So let's focus on Washington State. So driven by rising Medicaid costs, the Washington State Long-Term Care Trust Act of 2019 was passed. And this was the first state that established a social insurance program for LTSS. The program had been pushed by a grassroots organization called Washingtonians for a Responsible Future. and it's going to be available to all employed state residents. It's funded through a mandatory employee payroll tax. Now, the program is going to pay about $100 a day with adjustments for inflation for care provided in all settings, up to a maximum of about $36,500. And all workers who contributed to the program after a certain vesting period will qualify if they have a certain level of functional and cognitive impairments. It's scheduled to begin collecting premiums next year, and program implementation is set for 2025. If we look next at Hawaii, Hawaii does not have a social insurance program, but instead they focused on supporting family caregivers. And they have two programs to do so. One was a program that was implemented back in 2008. And it was designed to provide targeted home and community-based care benefits to individuals age 60 and over who weren't poor enough to qualify for the Medicaid program. The second and more recent program is called the Kapuna Caregivers Program. This was enacted in 2017, and it supports working caregivers by subsidizing paid care for their loved ones. A qualified caregiver for the program must work at least 30 hours per week and provide care to a qualified individual with needs. The third program is Minnesota, and Minnesota's reform efforts are unique because they actually focus first on options to enhance affordable private market solutions for middle-income families. A state-led Own Your Own Future advisory group identified two new product designs, a low-cost term life insurance product that converts to covering long-term care when someone hits age 65, and a product that embeds home and community-based care coverage in Medicare supplemental policies. Now, the state's role has been to provide actuarial analyses and other feasibility studies to fund those. And more recently, a government-appointed Blue Ribbon Commission is looking at exploring social insurance approaches like catastrophic insurance to supplement some of these private upfront policies. Next slide. So when we asked across these states, what is motivating these reform efforts, there is a wide consensus that reducing pressure on state Medicaid budgets is really concentrating the hearts and minds, easing the burden on caregivers, and providing financial help for the middle class. A lot of these coalitions that formed were motivated by these top three reasons. Let me briefly review now what we've learned. Next slide. What we've learned, some of the common themes and lessons. So when we talked to all these stakeholders, the first thing was getting the right people around the table and keeping the coalition broad and inclusive. So broad and equitable stakeholder involvement has been associated with moving initiatives forward. And as one of the stakeholders told us, you have to include all of the noses that are at the trough. And across a number of states, this meant making sure that both the aging and the disability communities were working together, citing in particular that the disability community had more activist energy. A diverse set of constituents also creates a more powerful coalition, and it makes it much easier for supporters in the legislature to work and coordinate with a single organization. Stakeholders also felt that the experience of initially focusing on issues that were more conducive to agreement was a critical investment in building a level of trust between members that would pay off when issues became more contentious. A counterfactual is actually offered by Maine, where a coalition first developed their own policy proposals, and then they used them to solicit additional stakeholder involvement. And it didn't work out so well because groups that might have been expected to support the Maine initiatives didn't do so because they were brought detailed proposals before they had a chance to really build trust and give input. The second point here is to have formalized processes and structures. What that means is what people would consider to be obvious, delineating rules, having regular meetings, subcommittees, and allocating staff resources to the process. For example, members in the California Aging and Disability Alliance, they developed and shared a dual loyalty statement among all members so that all documents and discussions were treated as confidential, and they were all on the same page. The second point is to build consensus around goals. Everyone said that it's critical to coalesce around shared goals first that had broad acceptance for the whole group. In this case, as I mentioned, the desire was to relieve burden on Medicaid and reduce caregiver burden. Now, what do these goals have in common? First, they're neither liberal nor conservative, Democratic or Republican leaning, but these are goals that everyone can get behind. Think about it. Almost everyone in the room today has some caregiving experience. And what we found is that coalitions that were furthest along in their process worked hard very early on to assure consensus around the definition of the problem to be solved and to stay focused on what they were trying to solve for. So there was also broad agreement that you can't solve all issues with one initiative. Third, understand that winning begets winning. Having small wins, like getting the legislature to even fund a small study of the issues, gives the coalition a feeling that it is making progress, and it helps to expand the coalition. This occurred in Washington State, California, Minnesota. Next slide, please. It's very important to recognize that this is a marathon and not a sprint. The pathway to LTSS reform can span many years, in one case, Hawaii, even decades. It takes time to invest in and sustain an effective coalition, and it requires discipline and effort to develop the consensus. Also, most importantly, design the politically possible solution rather than the technically perfect one. You need to focus on solutions that are appropriate to the politics that are possible. So, I'll give you a really interesting example. It turns out that designing the specific policy for a state is often not the most time-consuming or difficult part of the process. And that's because in a lot of cases, the analytic work has already been done to allow individuals to quickly evaluate costs and benefits of different programs. And Washington State comes to mind. They were quickly told that the legislature was only going to be able to raise taxes 0.5%. So basically, it changed the whole conversation. The coalition said, well, what does 0.5% buy us? And that really helped them get to a solution. That relates to my fourth point here, which is that data acquisition and third-party expertise really can oil the process. A lot of these efforts started with studies conducted by third-party experts. The purpose was to raise awareness and educate legislators, partners, stakeholders, and others about the nature and scope of the problem. And what you want is to provide a framework for discussions to make them productive and provide a common factual basis. This supports trust building and experience working together. Finally, timing is everything. The political climate in these states is important. In California, for example, after years of struggle, the state budget was finally in balance, a sense of fiscal crisis had passed, a state plan on aging was being developed, and a new governor interested in the subject came to power. Reform efforts in Minnesota are coming to the fore because other issues that had occupied a very prominent role on the policy agenda, such as healthcare coverage, were taken care of by the ACA, the Affordable Care Act. Even in Maine, which didn't succeed in passing a reform, there was a strong belief that high voter turnout in 2018 midterm elections would be a major advantage, and the coalition that was driving the issue could leverage past successes with a ballot initiative. While they did not ultimately succeed, it was not a matter of the timing in that case. On this last slide, and next slide, please. Thank you. I'm not going to read this, but frankly, this just presents really what our colleagues saw as the necessary ingredients for hitting the target.
You've got 2
And
minutes,
so
Mark.
with that, I'm going to conclude, and I'm happy to entertain questions. Thanks very much.
Well, thank you. I hope I didn't throw you off there. We have time for a couple of questions, Mark, if that's okay. One of those, they tie into each other. One of those is, of the current state models you see, does one or a combination of those two look like the most viable model, or is it just clearly the most politically expedient model per state that you would like for people to promote?
So I think that, first of all, the states have always been laboratories of experimentation. There's one state now that is in the process of implementing a full-blown social insurance program. And there are different models for that type of program. I do think that in order to address this very large problem, some combination of private and public insurance is going to be necessary. Why do I say insurance? I say insurance because the fact is, if you look at the distribution of use, roughly half the population over 65 is never going to need significant long-term services and supports. The other half is going to need it, and a percentage of those, 15%, are going to need it for a very long time. So when you have a very unequal distribution of risk, insurance is the answer.
Great question. Second question. Are there plans to do a follow-up study to determine the impact of these funding changes and to do kind of a long-term assessment of them?
I mean, that is something that I would very much like to do, actually. Once, even interim studies on how states are thinking through implementation issues. How does this work with Medicaid? Do you build on other types of state infrastructure? I would recommend, I was a leader of a task force for the National Academy of Social Insurance that put together a study about how states considering social insurance, what are the considerations that they would like to, that they should take into account. That talks a lot about these issues.
Thank you so much. That was outstanding. I appreciate your incredible presentation and of your research, and we look forward to seeing where you end up. Now we're going to move on to our panel presentation. This is looking at Tennessee's long-term support services system. We have 4 panelists. As you can see, Grace Smith, Director of Age Well Middle Tennessee, Tara Bergfold, who is the research analyst for Tennessee Comptroller, co-author of Senior Long-Term Care in Tennessee, Jim Schulman, Executive Director, Tennessee Commission on Aging and Disability, and Aaron Badley, Director of East Tennessee Agency on Aging and Disability. I'm going to let them, so I'm not going to introduce each one of them. They can introduce themselves. There will be no questions attached at the end of this because it have this many people involved. It takes a good, by the way, group, you got 27 minutes to do this. So I would like to go ahead and turn this over to Grace. I think she's just going to do a 2-minute introduction, and then we'll move on to Tara, then Jim, then Aaron.
Thanks, Steve. And I want to thank Dorothy for giving us that national perspective from AARP, and Mark for sharing with us the research that you've done on different states that are innovating their long-term services and supports. Now that we have that in mind, we thought it would be helpful to have this panel to really look at Tennessee's system. So we're going to present an overview of what Tennessee's system, primarily the government-funded long-term services and supports, what that looks like, how it works. Tara is going to lead us off and share some highlights from a 2017 long-term care report that the Comptroller's Office published, which is the perfect framework for talking about Tennessee's system. Then Jim Schulman will give us an overview of the Aging Services Network in Tennessee and his work at the Commission on Aging and Disability. Then Aaron Bradley will share his perspective as an Area Agency on Aging Director. And then lastly, I'm going to come back in and share with you some models from different sectors. We're going to zoom back out and look again, to Mark's point, looking at models from different sectors, knowing that we certainly can't rely on government to solve all of the needs of long-term services and supports. this is going to be a multi-sector solution that's needed for a robust system. So I'm going to hand things over to Tara and let her get us started.
Tara, you have 10 minutes. I'll give you a 2-minute warning.
Thanks. Hi, my name is Tara Bergfeld, and I work for a division of the Tennessee Comptroller's Office called the Office of Research and Education Accountability. In 2017, my office was asked to update a 2003 report on long-term trends in Tennessee. So as I present, just kind of keep in mind that some of this information, some of my numbers are a bit dated, but overall, the programs that I'm going to talk about are still relevant and happening in Tennessee today. Next slide. So first, before we talk about the programs, we need to get a lay of the land. The number of Tennessee seniors age 65 and over is expected to almost double from about 850,000 in 2010 to about 1.7 million in 2030. This population change is going to result in a significant growth in the demand for and the cost of public long-term services and support programs for Tennesseans. So with this growth, there are some things to keep in mind. These folks have longer lifespans and increased rates of chronic disease and dementia, while also possibly having fewer family caregivers available, and they might have lower savings to cover the cost of this long-term care. Now I'm going to give a very high overview of the 3 publicly funded programs in Tennessee that we have to support low-income elderly Tennesseans. There's TennCare Choices, which is our Medicaid program, the Options program, and the Older Americans Act program. In 2008, the Tennessee State Legislature passed the Long-Term Care Community Choices Act to rebalance and reorganize TennCare long-term care. It expanded the use of lower cost home and community-based services and provided more choice beyond just nursing care facilities in the type of long-term care services and providers that were available. The act acknowledged that the state's long-term care system should deliver services in the most cost-effective way possible to serve as many people as possible in their home and community settings while offering that continuum of long-term care services that we spoke about earlier. Eligible seniors fall into one of 3 categories. Group 1 receives nursing home care. This is the most expensive group. Group 2 may receive home and community-based services, but they can only receive it up to the cost of what they would receive for nursing home care. It cannot exceed the cost of nursing home care. And Group 3 is what we call the at-risk group. These are low-income seniors that receive Social Security, SSI, and are at risk of needing nursing home care without any long-term services and supports. Slowing down there. Next, we have the state-funded Options program. This is for older Tennesseans that are at risk of becoming Medicaid eligible. It was created by the General Assembly in 1999 in order to serve older individuals and adults with disabilities who do not qualify for long-term care services under the Medicaid long-term care services under Medicaid. Unlike Choices, which provides services to anyone that qualifies, the Options program only accepts as many people as state funding allows. This funding can be used for personal care, homemaker services, etc. And next slide. The average annual cost of Options is capped at $5,000 per person. In 2020, these expenditures averaged about $3,200 per person with about $9.6 million in state appropriations. This program does have a wait list, and as of November 2020, about 2,200 people were served, while another 2,500 were on the wait list. The Federal Older Americans Act provides federal funds for services and programs designed to promote the independence, care, and well-being of seniors aged 60 and over in their homes and community for as long as possible. These services include information and assistance, senior centers, nutrition and health promotion programs, legal and protective services, and caregiver support. The Older Americans Act is paid for with a combination of state and federal funds. In 2015, most of those were federal funds, about $22.5 million in federal expenditures and about $2.75 million in state dollars. The Tennessee Commission on Aging and Disability is the state agency that's responsible for administering these funds. TCAD develops a state plan within federal program guidelines to set priorities for the use of the funds, and then it distributes these funds based on a federal formula out to the state's 9 area agencies on aging and disability. And you'll hear from both the TCAD and one of the leaders of the AAAD shortly. These area agencies determine the services provided in their areas, and they contract with service providers to deliver these services. They're provided as available based on limited public funding, and recipients pay based on a sliding fee schedule. In 2015, about 140,000 people received services in Tennessee. Okay, switching gears to talk about how all these programs work in Tennessee. Nursing home care and long-term services and supports are very expensive. It is much less expensive to help people stay in their homes for as long as possible. Tennessee has made changes in its TennCare Medicaid program to help control for the growth in the cost of these long-term services and supports, but costs are going to increase substantially as this senior population continues to increase. So first, Tennessee expanded access, as I mentioned, to the home and community-based services for seniors that otherwise would have required more expensive nursing home care. Home and community-based services meet older adults' preferences to age in place rather than in a nursing home, and they reduce their cost of care to the state. Enrollment of TennCare eligible seniors in home and community-based services increased from about 11% in 2009 to 35% in 2016. And as you can see from this chart, it is much less expensive for someone to receive home-based care than nursing home care. In 2016,
2 minutes, okay?
okay, it was about $23,000 per person. Next slide. Second, Tennessee controlled for some growth in the number of seniors that qualify for TennCare long-term services and supports and the types of benefits they received by increasing the medical eligibility requirements for nursing facility services. TennCare has continued to make a more moderate package of home and community-based services available to those certain individuals at risk of needing higher care. According to TennCare officials, the previous eligibility requirements were more generous in Tennessee compared to other states. And so therefore, these heightened medical eligibility standards have affected enrollment in the Choices program. The number of seniors has stayed relatively steady or even decreased in recent years. But more research would have to be done to know if this trend continued past 2016. Next slide. We know that most seniors prefer to avoid nursing home care, and we know that home and community-based services such as the Older Americans Act, options, and this Choices Group 3 for at-risk seniors are designed to save money in the long run by preventing or delaying seniors from enrolling in higher cost TennCare choices. However, these programs either have waiting lists for services, do not serve all seniors who could benefit from them, or they're serving fewer seniors. Our analysis that we did back in 2017 found that if the state could avoid 1 year of Choices nursing facility services for 500 seniors, it could save about $5.5 million delayed in 1 year. And next slide. Lastly, our report included some considerations for policymakers. We need to look at that continuum of care that keeps in mind their preferences, their personal care and medical needs, and that is also most cost effective. And next slide.
It's time.
Okay, I'm finished.
Well, go ahead and finish your slide. It's great.
Sure. Lastly, we just have a few other considerations on expanding home and community-based services. We need to, as we mentioned earlier, develop and invest in those direct care workers. As this population increases, their demand is going to increase as well. And last, we included a consideration for further development of a single point of entry for accessing all of these services that are available.
Thank you, Tara. Dr. Schulman.
Well, don't call me a doctor. I'm not a doctor yet, but there's still time. And I hope I'm not penalized by Tara taking into some of my time.
I did not. It's
Okay, good.
Yeah, it's good.
All right. So I will say that study that the comptroller's office did was very, very important. It was the way I would look at it, it was kind of a key to kind of opening up everybody's eyes about what we need to do in the future regarding long-term care, particularly if you look at the report and the amount of money that is being spent now and will be spent in the future regarding long-term care, and the need to make sure that people are focused on it, because as everybody said on this call, very expensive and very hard for many people to get those types of services that are needed as they get older. So anyway, I think the comptroller's office did a really, really good job of looking at it. I would encourage people to take a look at it. I also want to thank Dr. Cohen. It was very interesting to look at what other states are doing in terms of this long-term growth. And as Dorothy with AARP said so well, look, from a Tennessee standpoint, people do want to live at home. We all understand that. They tell us that. You can see it in terms of every day what they do to try to fight to stay at home. And we need to listen to them, figure out how to help them do that. So Tennessee Commission on Aging and Disability, we're the state unit on aging. In Tennessee, every state has one. They're all called different things, but every state has one. They accept Older Americans Act funds. And that was talked about just a few minutes ago in terms of some of the programs that Older Americans Act funding comes through and helps with. We work with area agencies on aging and disability across the state. There are 9 of them. You're going to hear from Mr. Aaron Bradley in just a minute with the East Tennessee Human Resource Agency. He's with the East Tennessee AAAD. That's what they're called. And as the report said, our senior population is growing very quickly in the state of Tennessee. We have 1.2 million seniors 65 plus, and it's growing. And that's going to cause the need for services to go way up. What do we do at the Tennessee Commission on Aging and Disability? Just kind of briefly, we focus on things that in many ways help people live independently. We deal with senior nutrition. We provide a couple of million meals a year to folks who may be in need of a meal. We used to do it through congregate meal settings and home delivered meals. Right now, it's basically home delivered because of the pandemic. We had to switch over and make sure that people could still get their meals, just not in a congregate setting, which is like a senior center. We operate the options program, which we just saw on the screen. I would say, for those of you who don't know, when we were talking about $3,200, that's the cost. That's per year, not per month. $3,200 per year helps an individual get a limited amount of services to be able to stay in their home, which is, again, what people want. Somehow they manage to take that limited amount of services, whether it's in-home care, whether it's personal care services, that type of thing, maybe some meals, and they manage to work with families and friends to be able to stay in home with that limited amount of services. Again, $3,200 a year, not that much in terms of how or what services can be provided and how to allow people to stay at home. Older Americans Act provides support services, very, very important. That's also in-home care services, but it could also be transportation services. Very important, particularly during a pandemic, about trying to get people to the grocery store and the doctor's office and the pharmacy. Support services kind of expanded out. Older Americans Act, we get that. We give it out to the area agencies on aging and disability, and they provide services as well. Other things that we do, we run the SHIP program, State Health Insurance Assistance Program. That's Medicare assistance for people who are trying to figure out Medicare. And that's both for people with questions of the individuals who have it, and their family members so they understand it. And then we have a whole host of other programs, everything from an ombudsman program that comes to the Older Americans Act, which advocates for seniors who are in facilities or maybe need to get into facilities like a long-term care facility. We have a dental program that is piloted in Tennessee, senior dental, providing services to right now thousands of seniors that might not otherwise get services, legal assistance. And one of the interesting things that we got some extra funding for was home repair.
Okay.
So home repair, particularly for an elder individual who is wanting to stay at home with a limited amount of money, you can put in a rail, you can put in a ramp so they can get access into their homes, a railing or some type of grab bar in a bathroom. So for a small amount of money, we are able to start doing a limited amount of home repair across the state through a pilot program as well that allows people to get assistance in terms of that type of service. Everything we try to do with the Commission on Aging and Disability, I guess, in terms of a lot of the programs, always has kind of in the back of our mind the idea that seniors want to live independently, again, in their homes for as long as possible. So just a couple of other things real quick, because I know I'm about out of time. We did get an extra $1 million from the state legislature a couple of years ago from the state legislature in terms of the options program. But as you notice, we still have waiting lists, people still trying to get on that program. Again, people want to stay at home. And then I guess I would say one last thing that I think is important, and that is the Comptroller's Office study has encouraged us and TennCare, working in conjunction with everybody else, to try to figure out and solve some of these problems before they get completely and costly out of hand. So the report actually kind of made us start working together, which was a good thing. And I'll end on that note.
Thank you, Commissioner. I should have called you counselor instead of doctor, but I'm so.
You can call me whatever you want. That's fine.
I'm going to go to Aaron Bradley. Aaron, could you please step in and tell what's happening in East Tennessee and the work you're doing? You have 5 minutes.
Yes, sir. Thanks, Steve. I appreciate it. I want to say thank you to Grace and Dr. Powers and to the coalition for this opportunity. As was mentioned earlier, we've spent a lot of years working in this particular space at the Area Agency on the Aging level, and I want to make a few observations about things that I think we need to look at as a coalition and a state going forward. Part of our responsibility with the Medicaid system and choices in Tennessee is the single point of entry. And I think there's a great amount of good work going on between the managed care organizations and the area agencies on aging. But like every system, after 10 years or so, it's time to look to see if we can find some efficiencies, maybe create some better opportunities for clients in the community to access services more quickly. So I believe there's some real opportunity. For these discussions, I like to talk about opportunities and investments, because it's very difficult sometimes to put our head around what needs to happen for this population over the next 2, 5, 10 years. And usually the price tags are extremely high. So a lot of times we lose policy folks when you talk about change. So minor adjustments and some of what we're doing with single point of entry would be extraordinarily helpful. I think we have to look at growing home and community-based service options in our state to make the long-term care system in Tennessee, not just Medicaid, but all of what we're talking about today, healthier. We all know that there's a national and state crisis when it comes to direct care workers, and I think we have to look at reimbursement rates for home care providers as part of this discussion. If we're going to give folks more opportunities to stay at home and independent in the community, we're really going to have to invest in the home and community-based service network. And I think that has several different aspects. Rate increase might be one of those. But as Tara said in her presentation, looking over the last several years up to 2017, I think it shows that a lot of folks are receiving HCBS services at home, but I think there's some growth opportunities there. I would also like to see TennCare and Medicaid expand services to the at-risk. I know we had a broader definition of Group 3 some years ago. It's now been pulled down to only SSI clients, but a lot of times we identify folks in the community who need support at home but don't quite qualify for Medicaid because of their acuity level. And I think here's one of those investment opportunities I think we can make as a state to help folks stay independent and at home longer. I also think we need to look at some of the options other states have put in place over the last 15 years where residential homes are opened up under a new license that allows families to provide supportive services to elders and persons with disabilities in the community. This model has really caught on in a number of states, including Oregon and Colorado, and I think it's something we should look at to once again build HCBS capacity in our community. This would allow families to receive a license and be reimbursed either by private pay or by public sources to care for someone at home, and those homes would be monitored on a monthly basis. I would like for the coalition to consider asking Jason Mumpower, who is the Comptroller of the Treasury, to update the long-term care plan. Tara and her team did a phenomenal job in 2017, but it's 4 years ago, and I think it's time for a lot of reasons to look at that. So I think it would be wonderful. Thank you, Steve. I think it would be wonderful for the comptroller to take another look at long-term support services in Tennessee and look not just at Medicaid, but as they did before, all funding sources, and also look at options that might lend themselves to private pay, because I think that's an important feature in long-term service planning going forward. Government has a tendency to pay everything or nothing. And I think that mentality, whether it's federal, state, or local, I think we've got to spend some time tearing that down a little bit, because families need support. We've talked about family caregiver, but a lot of times with public funding, we don't step into that space unless we're going to pay for the whole bill, if you will, at the end of the month. And I think meeting folks halfway or meeting folks early in the process of caring for a relative is extraordinarily beneficial and would help us a great deal. So I think that is a good place to stop. Steve, I may give you a minute or two back.
Well, fantastic. Thank you. And that's wonderful. I appreciate your insight. I believe we're now moving back to Grace, and Grace will spend about 5 minutes talking, kind of pulling this all together.
Thanks, Steve. And Aaron, I love your emphasis on opportunities and investments. I think that's what our conversation is. We hope to inspire today through this. Now that we've looked at Tennessee's system and primarily the government funded programs, I'd like to bring us back to looking at multiple sectors, and particularly looking at some models, some that are here in Tennessee and some that are in other states. What's important as we look at these sectors, these models, is really to inspire our thinking, to think about what's possible, but also what do we want as we grow older, and realizing that it's going to take solutions from multiple sectors to create a robust long-term services and support system here in Tennessee. Mark highlighted several of these state examples, so I'm not going to go into detail, but just want to remind you about Hawaii and the Kapuna Caregivers Program with the subsidized paid care for working caregivers in Hawaii. Washington State with their social insurance program through the payroll tax. And then Minnesota is one I am personally very interested in, partly because they, on the long-term services and support scorecard, sponsored by AARP, the SCAN Foundation, and the Commonwealth Fund, Minnesota ranks #1. So that makes me very curious about knowing what are they doing in Minnesota to get at the top of that list in providing long-term services and supports. I'm really interested that they are focusing on a very broad middle class, because we know often that people don't qualify. They make too much money or have too many assets to qualify for some of our other social programs. So it's interesting to me to learn that there is a term life insurance that could convert into long-term care insurance. It seems to me worth investigating here in Tennessee. I also like what Mark said about how they're looking at an enhanced home care benefit to be embedded in Medicare supplement plans. So again, Mark, thank you for your research and for bringing those models to us. Looking at the private sector, Dorothy, I think you mentioned the Greenhouse Project that is reimagining what long-term care can look like, both in assisted living and in nursing homes. I was pleased to learn that we have 2 greenhouse homes here, models in Tennessee, one in Bartlett and one in Dandridge, Tennessee. And really, these are small scale, self-contained, designed long-term care that really is designed to feel more like home and to facilitate that community living, community interaction. I would say that I know, having gone to Abe's Garden here in Nashville, it has that same feel to it. So I really invite us to reimagine what long-term care can look like, knowing that people favor care that feels like home. Papa is also a very interesting private example of a company that is basically recruiting and vetting college and graduate students, particularly health professional students, to become Papa Pals and be matched with an older adult to provide companionship, help with chores, errands, technology tutoring, a variety of things. We've heard the workforce challenge, the workforce issue being discussed. This is an interesting way that the private sector is stepping in and looking at new pools of students who can help deliver some of those services and earn some money while they're in school in the process.
2 minutes, Grace.
Thank you, Steve. I may need just a little more than that, but I'm gonna speed it up. Public-private partnerships are a good example. Mon Ami is one that basically provides technology solutions for public agencies. One good example, they have recently partnered with the Pennsylvania Montgomery County Department of Health to use their technology to make it easier for volunteers to call older adults and enroll them, help them register for a COVID vaccine. So that's an interesting example there. The Capable program was designed by the Johns Hopkins School of Nursing for low-income seniors to help them age in place. It's a 5-month structured program that uses a combination of occupational therapists and nurses to make multiple home visits over that 5 months, and also have a handyman go out to do home repairs, home modifications that may be needed by that homeowner. Lastly, I want us to think about nonprofit models. There are many out there, and these are just a few that I wanted to mention today. The village model is very interesting. We have an example in Swanee, Tennessee, Folks at Home. You may have heard of villages before, and there's actually a village-to-village network across the country. Villages are often initiated within a neighborhood where there's a high concentration of older residents. They are membership organizations based on mutual support and benefit. Oftentimes, they will also vet service providers who can be made available to members through the village network. The Living at Home program is one that's run here locally in Middle Tennessee by 50 Forward and Catholic Charities. It's really a case management support program to enable older adults to keep living in their home. Volunteer assisted transportation is something that the Commission on Aging and Disability and the area agencies on aging and a number of us, including Age Well, have been very involved in fostering AARP as well. Fostering volunteer ride programs across the state to create a way for older adults who can no longer drive to safely get to doctor's appointments, the grocery store, wherever they need to go. The wonderful benefit is the social companionship that's provided through a trained and vetted volunteer who provides that ride and friendly conversation. So these are certainly an important part of our LTSS system in Tennessee. And lastly, our home repair and modification programs, Westminster Home Connection, Rebuilding Together Nashville, Habitat, all wonderful examples of this important segment of nonprofit delivered home and community-based support. One thing I wanted to stress is that with all of these nonprofit programs, the critical importance of philanthropy and also partnerships with faith communities that can really empower these programs, particularly ones that rely on volunteers, to be successful. So I'd like to wrap up my segment with a quote from a colleague who I really admire, Tolu Quinn with the Nashville Food Project, and this picture of a patchwork quilt, because as I think about the work we have to do to improve Tennessee's systems of support, it reminds me that we are going to need to be creative, that we're going to need to envision a system with multiple sectors offering solutions and woven together to create a robust system for us, one that's desirable, affordable, and helps us stay connected and engaged in the community as we grow older. So with that, I want to thank Tara, Jim, and Erin for being part of this panel. And Steve, we want to hand things back over to you. Thank you.
Fantastic. I want to thank all of our panelists today for providing an overview of the Tennessee systems and national issues and food for thought about opportunities and other LTSS models. Now we're going to wrap up real quickly. We'd like to invite you to be a part of kind of creating a word cloud that helps us make some decisions about the next two times we're together. So if you've never done this before, it's a group exercise where we'll see each other's responses. The words get bigger, the more people choose a word, the more same ideas chosen, the larger the word on the stage. It'll help us to see kind of where you're going. So use your phone, tablet, computer, whatever you want. You need to go to the website, menti.com, it's there, and then type in this code 15913316. And then enter your ideas up to the question based on what you've learned today. What values or principles are important to you in guiding Tennessee's long-term services and support systems? So go to menti.com, type in the code, and enter your ideas up to this question. We will use them to move forward. And we'll take about 3 minutes to do this. So hop in there and enjoy. All right. about 30 more seconds and we'll close it. All right. Thank you to all of you who responded with a wide variety of interests, as you can see, and we'll be capturing that, saving that, and it will help us as we move forward and make our choices for our next time together. Once again, I'd like to thank all of our panelists and our attendees today. Be on the lookout for an email with the follow-up survey. You'll have opportunity to provide feedback about today's webinar. And probably most importantly, you'll have a chance to opt in for the next 2 network meetings. We need you to do that. It's great that you came for information today, but the next 2 meetings are really important for shaping the future of long-term services and support in the state. So you see the dates of the next 2 meetings. And these meetings are actually work in small groups. We'll be using breakout rooms and having small group discussions and taking recommendations from you on the shaping of policy and direction. April 5th, 1 to 2:30 p.m. Central Time. We'll work on the guiding principles, take what we've learned today, other research. We'll use the ideas from the word cloud in that one and create agreed upon guidelines and principles for reimagining the services. On April 10th, we'll use the innovative state models we learned about today, along with other research, to develop shared strategies, policy ideas, and next steps. So we have just a tremendous couple of months ahead of us. On behalf of the Tennessee Coalition for Better Aging, thank you so much for being a part of this webinar. Thank you for joining this collective effort at reimagining long-term services and support in Tennessee. We look forward to seeing you in April. Good day.